Hello everyone. Let us learn in detail about the mandibular second premolar. So we know it's situated between the mandibular first premolar and the mandibular first molar. So its main function is to help the mandibular molars in chewing and grinding of food. Now before we start learning the morphology in detail, we have to mainly learn about the two forms of mandibular second premolar. Now basically this mandibular second premolar can either have three cusps or two cusps. So we have the three cusp type and the two cusp type. Now based on how the central groove on the occlusal surface is, the three cusp type is also called the Y type and two cusp type can be of two types, the H type and the U type. Now this is just the introduction part. Details we will learn when we talk about the occlusal aspect. But to begin with, we should know that there can be a three cusp type and a two cusp type of mandibular second premolar. Now let us start learning about the morphology in detail. Let us learn in detail about the buccal aspect. From the buccal aspect, the mandibular second premolar resembles the mandibular first premolar, and it is the only aspect in which these two resemble. So the crown appears shorter than the first premolar and the root appears longer. Coming to the details of the crown morphology, the crown overall outline is trapezoidal. The mesial outline is slightly convex till the contact area, which is in the middle third. The distal outline is highly convex again till the contact area, which is in the middle third again. But because of the convexity of the distal outline, it appears as though the mesial slope is slightly shorter than the distal cusp slope, but both the contact areas are in the middle third. There's not much difference between the cusp slopes. So we see only the buccal cusp from this aspect, as the buccal cusp is longer than the lingual cusps. So coming to the cuspal, that is the occlusal outline, so only buccal cusp slopes are seen, the mesial cusp and the distal cusp slope. Both the cusp slopes meet at an obtuse angle. It is a very rounded cusp tip, not a sharp cusp tip. And if we see a Thomas notch, we see it on the distal cusp slope, unlike the mandibular first premolar where we see it more on the mesial cusp slope. Now coming to the buccal surface as such, it is smooth and it is convex and it has a prominent buccal ridge on the buccal surface which runs from the buccal cusp tip to the cervical line. Now the cervical line is slightly convex towards the root. Now coming to the root morphology, it has a single root which tapers less and ends in a blunt apex. Now let us learn about the morphology of the lingual aspect of the mandibular second premolar. One general feature to remember, whether it's the three cusp type or the two cusp type, the lingual convergence is very less. So we don't see much of the proximal surfaces from the lingual aspect like we see in other teeth. The rest of the morphology of the crown we will learn according to the three cusp type and the two cusp type. Now from the buccal aspect, we already saw buccal cusp is larger than the lingual cusps. So we see from this aspect, we see all the three cusps, that is in the three cusp type. So this is the buccal cusp, this is the mesiolingual cusp, and this is the distolingual cusp. So when we talk about the crown, the main difference is in the occlusal aspect, right? So the occlusal aspect shows all three cusps, the buccal cusp which is longer, mesiolingual cusp which is wider and taller than the distolingual cusp. Distolingual cusp is a very small cusp and it can show a lot of variation in size as well. So buccal cusp is the largest, followed by the mesiolingual cusp, followed by the distolingual cusp, which is the smallest. This is in both in terms of size as well as height. Now what we see here, this groove is a lingual groove. So lingual groove is separating the mesiolingual and the distolingual cusp, and it is very short. It is not extending too much onto the lingual surface. Otherwise, the entire lingual surface is smooth and convex. The root also does not show much of lingual convergence. So that is about the 3 cusp type. Now when we talk about the 2 cusp type, the 2 cusp type will show both the buccal and the lingual cusp. Same thing, very little lingual convergence. So we see instead of 3 cusps, we see 2 cusps, one buccal cusp and one lingual cusp. Sometimes there can be a developmental depression here on the distal side, just where the distolingual cuspal ridge ends. There we can see a developmental depression sometimes. Otherwise, there's only 2 cusps seen. All the other features remain the same. Now let us talk about in detail about the mesial aspect of the mandibular second premolar. So we see 2 cusps and the root from this aspect. It doesn't matter whether it's the 3 cusp type or the 2 cusp type, we see only 2 cusps. That is the buccal cusp and the lingual cusp if it's the 2 type. In the 3 cusp type, we see the buccal cusp and the mesiolingual cusp. We don't see the distolingual cusp. Remember, we learned that the mesiolingual cusp is taller and higher. Taller and bigger than the distolingual cusp. So we see only the buccal cusp and the mesiolingual cusp. So let us start in detail with the crown. We see the outline is rhomboidal in shape. So coming to the buccal outline. So the buccal outline is convex and the height of contour is in the middle third. Coming to the lingual outline lies outside the confines of the root. You see the root border is extending here and ending at the lingual cusp tip. But the root outline is outside the root border. And the height of contour is in the occlusal third. This is something which is unique to this tooth. Okay, so buccal outline in the middle, height of contour in the middle third, lingual height of contour is in the occlusal third. And the contact area is somewhere here. Slightly buccal and in the occlusal third, or more likely at the junction of occlusal and middle third. That is where the outline is. Now coming to the occlusal outline. Occlusal outline we already saw, it shows buccal cusp and the mesiolingual cusp in the 3 cusp type. So the buccal cusp tip, if you see, is buccal to the midline. Because of this, the lingual tilt is lesser compared to the mandibular first premolar. If you saw the mandibular first premolar, the buccal cusp tip was actually at the midline of the tooth. Then the lingual cusp tip is in line with the lingual border of the tooth. And if you see, the lingual cusp is very much developed when compared to the mandibular first premolar. Also, another difference would be in the mesial marginal ridge, which is perpendicular to the long axis of the tooth in this tooth. Whereas in the mandibular first premolar, the mesial marginal ridge was sloping lingually. So these are things to keep in mind. So the crown is rhomboidal in shape. Buccal outline is convex with the height of contour is in the middle third. Lingual outline is convex, height of contour in occlusal third, and lingual outline lies outside the lingual border of the root. Buccal cusp tip buccal to the midline, lingual cusp tip in line with the lingual border of the root. The mesial marginal ridge is perpendicular to the long axis of the tooth, and the cervical outline curves slightly occlusally. Please notice this, it curves slightly occlusally. The contact area is at the junction of occlusal and middle thirds and may be slightly buccally or centrally placed. The contact area is quite broad. Now the root is flatter and usually does not show any depressions. Very rarely you can see a convexity, but it is otherwise flat, shows less taper, conical with a blunt apex. Now coming to the distal aspect. Now here we have to talk about the 3-cusp and the 2-cusp type separately. Now the buccal outline and the lingual outline remain the same. Rest of the features are the same. The contact area is much broader because that side it is in contact with the mesial side, it's in contact with the first premolar. So the contact area is smaller when compared to the distal side because it's in contact with the molar. It has a much broader contact area compared to the mesial side. Okay. Now the main difference is in the occlusal outline. So when we see the occlusal outline, we see that the buccal cusp, and in the 3-cusp type we see both the cusps, that is the mesiolingual and the distolingual cusps. So from this aspect we are seeing all the 3 cusps. So the distolingual cusp is the smallest, the mesiolingual cusp second largest, and the buccal cusp. So rest all the features remain the same. Even the root, no depression, everything remains the same. Now the difference here is that from the 2-cusp type, we will be seeing only 2 cusps occlusally, right? So we will be seeing the buccal cusp and the lingual cusp. Now another difference to remember from the mesial aspect is that the distal marginal ridge is at a lower level than the mesial marginal ridge. So we can see a little more of the occlusal surface on the distal aspect than the mesial aspect. This is true for both the 2-cusp type as well as the 3-cusp type of the mandibular second premolar. Now coming to the occlusal aspect. So here we are going to discuss the 3-cusp type and the 2-cusp type separately. So first, starting with the 3-cusp type, because that is the most common type of the mandibular second premolar that we come across. Now the 3-cusp type of premolar outline is a square. As you remember, we discussed that there is hardly any lingual convergence. That is even more prominent with the 3-cusp type. So it has a square outline. So mesiodistal and buccolingual widths are almost the same. Okay. So we see 3 cusps. So we are seeing 3 cusps. The buccal cusp, which is the largest, the mesiolingual cusp, and the distolingual cusp. Buccal cusp, mesiolingual, distolingual. You can see that the distolingual cusp is the smallest in size as well as height also. So next are the ridges. So we have the cuspal ridges, but mainly we have one triangular ridge coming from the buccal cusp. Then we have the triangular ridge coming from the mesiolingual cusp, and we have one triangular ridge coming from the distolingual cusp. So there are 3 main triangular ridges, and if you see, there's no transverse ridge being formed in this tooth. Apart from that, we have the mesial marginal ridge and the distal marginal ridge next to the triangular foci. Okay. So triangular ridge of the buccal cusp, triangular ridge of the mesiolingual cusp, triangular ridge of the distolingual cusp, no transverse ridge. This is the mesial marginal ridge and this is the distal marginal ridge. Okay. So those were the ridges. Now let us look at the pits and grooves. We will start with the pits on this tooth. You will understand in a little while why I am talking about the pits first. Now if you see, all the 3 cusps are being separated by grooves. Okay. We will mark the grooves. We will name them a little later. So there is one groove here. Right. Next there is one more groove here. And there is one more groove here. So these are the 3 grooves that are separating the cusps. Now there are some pits here, here, and here. So this pit is called the central pit, which is in the center of the occlusal surface. This pit will be the mesial pit and this pit will be the distal pit. So central pit is formed where the developmental grooves separating the cusps meet on the center of the occlusal surface. Then the mesial pit is in the mesial triangular fossa. Distal pit is in the distal triangular fossa. This central pit, if you see, is in the center buccolingually, but it's slightly distally placed because the distolingual cusp is smaller than mesiolingual, so it is slightly distally placed. So center buccolingually, but when we see mesiodistally, it is more distally placed and not in the center. Now let us talk about the grooves. Now when we talk about the grooves, I shaded one in blue, one in orange, one in green. We will see why is that. Now let us take these grooves. All three are primary, that is the developmental grooves. Now this groove on the mesial side, which is separating the buccal and the mesiolingual cusps, will be called the mesial developmental groove. This is the mesial developmental groove. Now the groove separating the buccal from the distolingual cusp will be called the distal developmental groove. And this one separating both the lingual cusps will be called the lingual developmental groove. So the mesial developmental groove starts from the central pit and it is going on to the mesial triangular fossa. Now the distal developmental groove starts at the central pit, goes on to the distal developmental fossa. Now from the central pit there is a groove running lingually and it will extend on to the lingual surface for a short while. So this is going to be the lingual developmental groove. So that will be separating both the lingual cusps. So if you see, all these three grooves form a Y on the surface. Right, occlusal surface. That is why this mandibular second premolar 3 cusp type is also known as the Y cusp type. So now in some books you might also see the word central groove being used. Some of the books also use, like these two are called the central groove and then here the lingual groove. But the current terminology says this is the mesial developmental groove, this is the distal developmental groove, this is the lingual developmental groove. So you can use this terminology to describe the morphology. So next is we talk about the fossae. So the fossae, there are only two fossae, that is the mesial triangular fossa and the distal triangular fossa. Now actually in this mandibular second premolar, the fossae are shallow and irregular, sometimes even circular in shape. They are not exactly triangular. So some of the books also like to use the term occlusal fossae instead of triangular fossae because they are not triangular in shape. But anyway, for convenience purposes, we will call them mesial and distal triangular fossae. So this is the occlusal aspect of the 3 cusp type. Square outline, 3 triangular ridges from each cusp and marginal ridges, no transverse ridge. Mesial developmental groove, distal developmental groove, lingual developmental groove. Central pit, mesial pit, distal pit. So that about sums up the 3 cusp type. Now let us go on to the 2 cusp type. Okay. 2 cusp type is also more circular rather than squarish in outline, but here also if you see, next to the buccal line angles, the rest of the outline is rounded. It is not very, again it does not show much of lingual convergence. So same ridges, buccal and lingual triangular ridges. Transverse ridge not very prominent, but the main thing why it's called so is because of the central groove. Now this one has a central groove, right? If you see here it is straight, then we have the triangular fossae on either side of this, right? Now if we take, this is obviously the H type because if you see the central groove is H type. Now if you see the other type, The other type of the two cusp type, instead of the lingual cusp is there, but it looks more like a convexity than a properly developed cusp. And the central groove is more of crescent shaped or U shaped. So this is called the U type because the central groove looks like U type. Right? So these are the triangular ridges. In both two cusp type, we can have a transverse ridge, but not in the three cusp type. So we have the U type and the H type. In the U type, usually the mesial and distal pits are prominent and there's no central pit. H type also no central pit. Pits can be present here, but they're more common in the U type. Okay, so this is the two cusp type of the mandibular second premolar. There are, instead of mesial, lingual and distal developmental grooves, the term central groove is used in both the two cusp types. That is the main difference. Otherwise, the fossae and the marginal ridges remain the same.